To perform the treatment, I will be using the award-winning Soprano Ice Platinum laser. And we do full face, isn't it? How about a little bit under the chin?
Yeah, you can do that.
Yeah. Mm-hmm. And you've shaved it, yeah? Everything.
Yeah.
We've done for you before, isn't it?
Yeah.
I think that's perfect. Just gonna do the lips very quickly, just in case. Done. Hello and welcome to Ray Cochrane Aesthetic Academy. I would like to show you today how to perform a laser hair removal treatment on dark skin type, full face. So this is a procedure which usually it's not included within your syllabus when enrolled on our laser level 4 an IPL course, but we always show the learners more than they actually should learn. So this is something additional, so I want to show you how exactly to perform that treatment. So I'll show you preparation. So at the moment my customer, she's skin type 5, which is, you know, Asian skin type, darker Asian. And she, as you can see that, you know, she's not that dark, but the skin is darker. So we consider skin type 5 and we have to set up our machine for treating darker skin. It's much more difficult and we have to be much more careful when we're treating dark skin due to the melanin production on the skin. I've cleansed the skin, her skin is absolutely clean, no makeup, no dirt, no pollution. And then now I need to divide my the face into different areas because it's just easy to treat. So yeah, I'll do that now. Let's start. Okay, so I have my customer here. Since I'm quite close to her, I usually wear a mask, but it's not a compulsory. I always work with gloves. This is a treatment you must perform with gloves, very important. So I'm going to now use a white pencil to just mark my area. So let's say I'm going to do the forehead. Usually I'm going to set up that area up to here, okay? Okay, so we're just marking that. Then we will be doing that area as a one whole thing. So I'm just gonna go under the eyes. Very often customers have hair just here. So we will mark that. We'll leave that as an upper lip. And this is going to be our chin. Now up to here. And she has a little bit on the neck. Okay. I will do the other side, just a little bit like that. They always have that hair here. Good. Yeah. So along the jawline, up, close to the lips. That's it. And then here we're going to do separate the neck area. So we're trying to kind of follow the bone structure because that's going to be on our way all the time. So usually forehead here, it looks a bit flatter, so we can't just do the full forehead all the way through. So we just do forehead half of the side of the face, like the cheeks, all of that. Absolutely fine. Half of this area because obviously we're trying to avoid that bone because we cannot do that with the handpiece. And then of course we're going to do the upper lip. The upper lip we are doing first one half at the time, and then we do the one side of the chin at the time as well. So this is more or less what we are going to be doing. Okay, so that's my pre-drawing and then I'm ready to start. When we perform laser hair removal treatment on face, it's slightly different than the body. Usually on the face we need at least 8 sessions to start with because facial hair it's a hormonal area. So if you have hair on the face, it means that it's more like a hormonal issue. So usually you always will need more like maintenance in the future. It depends. For example, customers with polycystic ovary, ovaries have that issue. It's very common among them. And we always tell them that it's more going to be like a maintenance in the future, but definitely we're going to see a huge reduction of the hair, and we call that permanent hair reduction. So when we are treating face, we are also following 4 weeks interval to start with. So the customer need to come every 4 weeks. Probably after the 5th, 6th or 7th session, we're gonna extend that time. So instead of coming in 4 weeks, she needs to come in 6 weeks, 5 weeks, 6 weeks, 7 weeks. It really depends on the hair growth. We always follow this hair growth cycle. We have 3 stages of hair growth: anagen, catagen, and telogen. They all grow in different kind of time, and we have all those stages at one time in our body. So with each session, we are probably reducing 10% of the hair. It really depends. It's very, very personal. Like it's very individual for everyone. So we always say, start with course of 6 to 8 treatments at least, and then probably you can get another course, or you can do some maintenance in terms of another maybe 3 sessions. It really depends because everyone is different. But yes, so very important for customers to avoid the sun exposure during the course of treatments. No active sun exposure, because it's still, I mean, that laser superanoise pattern, it's amazing because you can do actually on tan skin. It's very, very safe, but we still have to be careful with the sun. We don't advise clients to do the treatment and go straight away to do sunbathing. That's not good. Or like, for example, to come straight away after the holiday, although you can do that absolutely fine. Also avoid any kind of like hot shower, steam sauna, 48 hours post-treatment, really important. No exfoliation for 5 days. And no, as I said, like active sun exposure is not recommended. Always apply sunscreen. One of the most important things, you have to protect the skin from the sun, from the harmful UV rays, because the skin definitely is more photosensitive when we perform laser treatment. And yeah, that's it more or less. Now we can start with the treatment. To start with the procedure, I will need to apply ultrasound gel. It's just clear ultrasound gel. So be careful because there are different colors of ultrasound gel. So we need the transparent one, although the light can absorb. I mean, if it's colorful one, can absorb the light. So we need ultrasound gel and a spatula. So I'm going to apply now the gel. Not too much. I'm going to start from forehead. Okay, so 1, 2, 3. Good. Bite your lips for me. Mm-hmm. Good. Nice. Good. Done lovely. Good. So that's all done. So we don't need too much gel because it's just gonna be useless. And now I have to protect my clients, my customers' eyes, one of the most important things. So I need cotton disc and my metal goggles. And I'm going to do that. And we are ready to start. Okay, so I'm just going to look at my parameter settings. So we are looking at skin type 5 settings. So we have skin type Fitzpatrick skin type. So my customer is skin type 5, Fitzpatrick skin type 5, phototype 5. That means that we need to look at the fluence, including face and bikini, it says here. So we can see that it says 5, so my fluence will be 5. Okay, and then my energy, which means the size of the area, will be depending on the actual area. So at the moment, for the forehead, we are looking for 3. So we are going to do 3 here, 3 under the chin, 3 here, 3 under the chin, and my sides are more looking like 4 to 5. So we can do 5, for example, but like forehead under the chin is 3. So because of this, we can actually do forehead under the chin, forehead under the chin. So I don't have to change the settings, and then I can do the 2 sides, and then I can do the small areas like chin, upper lip, and the nose. Okay, so we can just start now. So I have my glasses on. So I have to be just very careful with her eyebrows so you can see them. So I'm just gonna literally put that cotton disc on here. Okay, and I'll hold it. Are you ready, Alicia? Yeah? Okay, so I'm gonna start now. 1, 2, 3, 2, 3. Okay, so I just have to be very careful with her hairline, and I'm always placing it first, and I know exactly where I'm going. Because we can see our light, we can see our actual glass applicator. Good. So I will carry on below. So move my glasses a bit, my goggles. So move my goggles a bit. That. Are you comfortable? So when I go to that side, I need to make sure that I'm starting from here as well, so I know exactly, so I can catch all those little hairs. Good. Now do the bottom one, and you can just lift your head a bit. So the other side, we will start with forehead. So we're starting with the side. Good. Just going to do the bottom. Lift a bit more. 1, 2, 3. So now we're gonna go through the chin, and we will set up different. Ready? 1, 2, 3. Bite your lips for me a little bit, just a little. Yeah, perfect. I just performed laser hair removal treatment on full face, skin type 5, darker skin type, and my customer, it's absolutely fine. She felt just a little bit of heat and a little bit of like pinching, but that's it. So now I have to remove the gel and apply sunscreen on the face. To perform the treatment, I will be using the award-winning Soprano Ice Platinum laser by Alma Laser International Company and the 3D handpiece, which we're using on our course. So we're just removing the goggles now. How do you feel, Alicia? Don't open your eyes yet, because it's a bit too strong. Just you can lift your head a bit, that's it. So I will just remove it with the spatula first. And then I'll wipe off the lines. So, very important, no sun exposure for at least, a couple of weeks after the treatment. Always apply sunscreen on the exposed to the sun area we've treated, for example, the face. If it's too sunny outside, wear a hat, sunglasses. Yeah, it's good to prevent. Sunscreen, should be applied every morning. And in general, yeah, sunscreen should be like at least 30, but I advise you to use 50. And the next treatment should be in 4 weeks' time. Avoid any exfoliation as well for about 5 days. No heat treatments like sauna, active exercises, steam room for at least 24 to 48 hours after the treatment. Very important. Well, if you feel extra heat, you can apply aloe vera gel or like a cold compresses. So just going to wipe the lines now, which is with a baby wipe can be, and some toner, it's okay. Okay. You can see a little bit of redness here and there, but that's fine. Also, I don't advise you to do any active exercises like cardio, because they stimulate also the body, but just be a little bit more careful, at least for a couple of days. And I'll just apply sunscreen. So just a sunscreen on the area.